Getting help for your mental health. A guide to providers. Dr. Sherilyn Walker. Deciding to get help to improve your mental health is always the right decision. However, with so many types of providers, it can sometimes be daunting to choose where to begin. This video will clarify the credentials of different types of mental health providers, their treatment approaches, and other information. What is a therapist? A therapist, also called a counselor or a provider, holds a minimum of a master's degree in counseling, psychology, social work, or a related field. Some therapists have a doctoral degree, PhD, in counseling or psychology. A master's level therapist has also completed several hundred hours of a practicum, like an internship, as part of their graduate school education. They must pass a state board licensure exam. They complete approximately 3,000 hours of internship under supervision before receiving their official license to practice. Therapists can be identified by their licensure, which is listed as a suffix following their names. Common therapist licenses include Licensed Professional Counselor, LPC, Licensed Clinical Social Worker, LCSW, Licensed Marriage and Family Therapist, LMFT. These licenses may vary slightly depending upon the state in which the therapist is licensed. What is a psychologist? A psychologist holds a minimum of a doctoral degree, PhD, in psychology. The degree may be a Doctor of Philosophy, PhD, or a Doctor of Psychology, PsyD. Psychologists complete coursework as part of their graduate degree, followed by several thousand hours of internship and a state board exam. One can identify a psychologist by the suffix that follows the last name. This typically includes a comma, followed by a PhD or PsyD, and LP, which stand for Licensed Psychologist. Again, the amount of training and specific requirements vary from state to state. What is a psychiatrist? A psychiatrist is a medical doctor who has completed a 4-year degree program at an accredited medical school. Psychiatrists also complete an internship and a residency, specializing in mental health, that lasts about 3 years. A psychiatrist can prescribe medication. Other psychiatric prescribers. In addition to MDs, there are other specialists who can prescribe medication. The first is a physician assistant or PA who attended a master's degree program and is licensed to prescribe medications under the supervision of an MD. Additionally, a nurse practitioner has a graduate degree in nursing and is a specialized advanced practice nurse who can prescribe medication. How can these specialists help? Therapists or counselors help by providing talk therapy. Some therapists obtain specialized training and or certifications in various therapy techniques, depending upon whether they work with children and adolescents, adults, or both. Some therapists specialize in working with married couples and families. Psychologists also provide counseling and talk therapy. However, psychologists can perform additional types of testing that master's level therapists cannot. Neither a psychologist nor a therapist can prescribe. Psychiatrists, physician assistants, and nurse practitioners prescribe medication to address the symptoms of mental health issues. However, they do not typically provide counseling and psychotherapy. They will ask about your history and refer you to a therapist if you do not already have one. Do I have to take medication? One does not always have to take medication. It depends upon the nature of your mental health issue, and this is best addressed with a psychiatrist or a prescriber. They can advise what is best. However, many people resolve their symptoms through therapy alone. You can decide later if you want to add medication.